Hi, I'm Noemi, and this is my son Arlo. He's 4 months old now. I got vaccinated against COVID-19 when I was pregnant, and I did it for myself to keep myself healthy and for him to help protect him against the virus as well.
Hi, my name is Sarah Gill, and I got the Pfizer vaccine in my 3rd trimester of pregnancy because I wanted my babies Tallulah and Major to have antibodies and to protect me. We lost our mother-in-law in 2020 to COVID, and it devastated our family. So we wanted to protect our family and others. And my twins were born at 9 pounds 9 ounces, 7 pounds 7 ounces. They're almost 3 months old, and we're doing great.
Hi, my name's Rebecca and this is Harper. I'm glad that I was vaccinated at 22 weeks to help protect my community, but most importantly, my family. Harper was born full term, a healthy and happy baby, 8 pounds and 8 ounces.
I got vaccinated for my health and my baby. And now we have a precious baby boy who's healthy and happy.
Hi, my name is Sarah Natalie, and I gave birth to my son a little over 5 weeks ago at East Alabama Medical Center. My local obstetrician asked me to share my decision on why I got the COVID-19 vaccine during my pregnancy. I also want to acknowledge that I am an employee of East Alabama Health as one of the executive vice presidents for the organization and also the chief operating officer. In my position at work, I've had a front row seat to watch COVID-19 in our local community and its effect on healthcare workers at East Alabama Health from the very beginning. My decision to receive the vaccine was born out of my personal trust for science. Really, I believe that the same God who created mankind is the same God who imparted wisdom on men and women to give them the scientific knowledge on vaccines. Not only vaccines, but I believe God imparted wisdom on scientists to develop treatment for healthcare diseases and illnesses, treatment including monoclonal antibody infusions that have helped so many during the COVID-19 pandemic. I also consulted with my local healthcare providers, trusted scientific experts, and listened to their communications regarding the efficacy of mRNA vaccines, the fact that they've been studied for decades and they've been proven safe for society. I've been fortunate to have been raised in a country where vaccines have been afforded to myself, my family, the greater society to protect us against diseases and illnesses that have been deadly to generations before us. And fortunately, most of society heeds those vaccines, and we are protected again from illnesses that have killed so many in the past. Also, the American College of Obstetrics and Gynecology, as well as many other professional organizations around the United States, have deemed the COVID-19 vaccine not only safe for pregnant women, but needed for pregnant women. And I listened to that advice, and I'm thankful that I did. My initial decision to vaccinate myself really, again, was born out of that trust in God-given science, to protect myself, to protect my unborn child, to protect my family, and to protect those around me, and to prevent the spread of COVID-19. As time has gone on, we can see the 3 peaks of COVID-19 in the past, and hopefully this 4th peak, this Delta variant that's still ongoing, will be in the past soon enough. With that knowledge, I have one more very clear reason to add to my decision to become vaccinated, and that is the healthcare workers. We know that you can get a breakthrough case of COVID-19 even if you've been vaccinated. The Delta variant is highly contagious. We can all agree on that. But one thing we can also all agree on is that if you have had the COVID-19 vaccine, you are far less likely to need and require an inpatient hospitalization. That means you are far less likely to consume the very fragile and limited resources in healthcare today. That is where we are today. Getting the COVID-19 vaccine means that you're protected. For me, for this precious baby, it means that he's protected. He has antibodies through me that he received in utero. But it means that I'm protecting the very fragile local healthcare infrastructure, but the greater healthcare ecosystem in the United States by doing my best not to overburden any more than it already is overburdened. And that is where I would ask everybody to consider that, at least if you haven't. That being vaccinated means you are less likely to need the limited resources. That means you are caring for healthcare workers above yourself. And I would ask you to consider that in light of the fact that the vaccine has been proven safe. It's been proven effective in keeping you out of the hospital. And I'm very thankful for that science. I'm thankful that God has given men and women the knowledge to provide that to us. And in closing, I just want to say that it's my hope that this very brief message offers you truth and insight and hope yourself. And I thank you for listening.